I'm going to go ahead and get started. My name is Kara McMullen, and I'm the project manager of the Burn Model System National Data and Statistical Center. I received my master's in public health and community health sciences from the University of California, Los Angeles, and I've been working in the rehabilitation research field for over 10 years. So today we're going to be talking about accessing and using the Burn Model System database. So for the first half of the webinar, I'm going to provide kind of a 30,000 foot view of the variables collected by the BMS and an overview of the BMS as a whole. I'll talk a little bit about the data collection methods, and I'll introduce the BMS data dictionary. And I'll also highlight some resources available to outside researchers and show you where you can find further information if you're interested in the data. In the second half of the webinar, my colleague Alyssa Bamer will introduce a case study in using the BMS database, including how to look at the data dictionary and develop a research question, and how to fill out a data request form for accessing the data set. So to kind of set a groundwork for the webinar, I'm first going to talk quickly about what the BMS is. It's a research project funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. The BMS program seeks to improve, through research, the care and outcomes for people with burn injuries. The BMS research programs are housed in clinical burn centers that provide a multidisciplinary system of care, including emergency medical, acute medical, post-acute, and long-term follow-up services. In addition to those services, each BMS center conducts research such as site-specific projects, module projects, and they also contribute data to the BMS National Database. So what is the BMS National Database? It's a prospective, longitudinal, multi-center research study that examines health, functional, and psychosocial outcomes after burn injury. The data has been collected since 1994 from adults and children with moderate to severe burn injury who receive treatment at burn centers funded by NIDLR to do this research around the United States. The inclusion criteria have changed over time, but there's information on that on our website, which you can find the link below. And I'll also be doing a quick orientation to our website in a few minutes. So here you can see just the geographical location of the participants in the BMS and the BMS centers. So we have current BMS centers in Seattle, Washington, Galveston, Texas, Dallas, Texas, and Boston, Massachusetts. And there are past BMS centers in Denver, Colorado, and Baltimore, Maryland. And we do have some participants in Alaska, as well as participants from Mexico. So we at the BMS National Data and Statistical Center are funded to help the BMS centers collect and store the data in the database. We manage all the data, we clean it and score the data and provide it for researchers in a usable format, excuse me. The National Data and Statistical Center is currently located at the University of Washington in Seattle. And we at the NDSC are really your resource for help if you have questions about the database or other BMS questions. We're funded to not only help the BMS centers, but the burn injury research field as a whole. So don't hesitate to reach out and ask us any questions you might have. So BMS resources, one of the things that we try to have on our website is as much helpful information as possible for researchers interested in the BMS database. So I'm going to do a quick orientation to our website because it is a lot of information. So I wanted to kind of cover that to make sure that people know where to find what on our website. So on the homepage, we have links to each of our 5 subject areas that we really work on, which is data collection and management, statistical and analytical expertise, access to the BMS data, snapshots of the BMS data, and training and technical assistance. And what I'm going to focus on today is the resources on the access to BMS data page, which is the page for information about getting any kind of access to the BMS data. So we have an infographic about the process.
Kara,
and
briefly, you're not showing the website, you're just showing the slide.
Thank you.
Yeah, sure.
Okay, thank you, Alyssa. Okay, so this is the homepage. This is the 5 areas of work that we do. And like I said, I'm going to focus today on the access to BMS data page. So on this page, we do have an infographic, and then if you keep scrolling, there's a lot of information. It is text heavy, but there's a lot of resources here, so I wanted to highlight some of those resources. So we do have a quick introduction to what the BMS National Database is, with links to the standard operating procedures of the BMS, which lay out further information about inclusion criteria, follow-up data methods, follow-up data windows, kind of everything that the BMS does is laid out in a standard operating procedure. And then we have a section about who can use the database, which is really everyone. We welcome the use of the data by anyone who is interested in sharing our goal of improving lives of burn survivors. And then if you keep scrolling, we have the BMS National Database objectives, a description of what's in the database. And because there is a lot of data and it's been collected over a long period of time, it is a somewhat complicated data set. So we do have some tools to kind of help guide you through that complication, one of which is a timeline of the variables that have been collected across the lifespan of the project. And Alyssa is going to be talking about that a little bit later. And there are two types of BMS data access. One is that there is an annually published public access data set that can be downloaded at any time. It contains data collected up to 2 years prior to its publication date, and data are stripped of all HIPAA-defined identifiers, including names, geographic subdivisions, elements of dates, etc. And then the custom data access is what Alyssa is going to be talking about. You're more than welcome to access the public access data set, but we do recommend a custom data set, because it comes with a little bit more support, and we at the NDSC can help curate a data set for you so it doesn't have any extraneous data, and it's available free of charge to researchers with specific hypotheses. So if you keep scrolling, there's some information about what the difference is between annually published and custom data sets, and then a step-by-step list of how to request a BMS data set. And Alyssa is going to be covering this information later in the webinar. So as we keep going down, this for researchers interested in the data, this is really the paragraph that has all of the resources in the BMS. So we have a list of publications in progress, which I'll show you in a minute. And then it also has the BMS data dictionary, which I'll also be showing you in a few minutes. We have the BMS codebook, which Alyssa will be talking about a little more. And then there's also a PowerPoint presentation that guides you through the BMS data dictionary that covers much of the information that we're also covering in this webinar. And then we posted it again because it's such a helpful tool, but the PDF that provides the timeline of what variables have been collected at which time points. And then below we have the webinars, which this is being recorded, and we'll post it here once we've recorded it and edited it. And then public access is at the very bottom here, where you can obtain this free public version of the data set. You just go to this link. You do have to fill out a data use agreement, and it does contain data collected from 1993 through the end of 2018. Okay, so I will go back to the PowerPoint. So I wanted to really quickly just talk about some helpful terminology that I'll be covering in the rest of this webinar, just to make sure that we have the same understanding of terms. So an item is one question or data point in a data set. A measure is a collection of several items that usually assess one predetermined domain. The data center is the Data Management and Statistical Center. We don't collect data, but we do manage it. And then the burn centers are clinical burn centers funded by NIDLR that do collect the BMS data. Longitudinal is a series of data over time, i.e. the same item collected at 6 months, 12 months, and 24 months. And cross-sectional is data collected at one time only, i.e. total body surface area burned collected just at hospital discharge. Outcomes are physical, social, or psychological sequelae after an event, i.e. a burn injury. And then in places in the BMS, you'll see references to Form 1 and Form 2. Form 1 is the hospital discharge survey, and Form 2 is the follow-up survey that's used at all points of follow-up data collection. So I'll dig in a little bit and talk about the types of data in the BMS database. We have patient demographics like age, sex, We have pre-injury history, such as military service, employment status prior to the burn. We do have information about the cause and injury characteristics, such as TBSA burned, cause of the burn, burn location, place of injury. And we do have some information on treatment, including the length of the hospital stay, ventilator days, number of burn-related surgeries, and more. And we do have information also on hospital discharge, including disposition, symptoms and problems, which are all accessed through self-report, things like pain, itch, and sleep, functional outcomes, depression, PTSD, physical function, employment and school status after burn injury, and then some patient-reported outcome metrics such as satisfaction with life and Promise 29. So when the BMS data is collected, we do attempt to collect data at all the below listed time points from everyone who consents into the study at the time of hospital discharge. So different information is collected at discharge compared to all other follow-up time points. And the same data is collected at all follow-up time points. So we collect a survey at discharge from acute injury, 6 months, 12 months, 24 months, and then every 5 years going forward. And you'll notice these numbers in parentheses are the data collection windows. So data is collected from the medical record and from self-report. From the medical record, the BMS Center staff collect that information and enter it into the database. This includes things like burn size, weight, height, age, surgeries, and more. And self-report is done in person in the clinic via an interview, over the phone via an interview, and through mailed or online surveys. And that includes many of the patient-reported outcome measures, such as satisfaction with life, global health, employment, marital status, pain, itch, and more. So as you can see here, we have a lot of people in the database. As of last week, when I pulled this data, we had almost 7,000 people who'd consented into the study at discharge. At 6 months, we have almost 5,000 people who've provided follow-up data. At 1 year, we have over 4,300, and at 2 years, we have over 3,600. And we do have those long-term follow-up time points, the 5, 10, and 15 years, and every 5 years thereafter. But that's a relatively recent addition to the database, so those numbers are lower than what you see here. So we've already talked a little bit about the timeline of the measures, but it is, because it's a complicated and long-term research project, the duration that a measure was collected does impact the sample size of that measure. So for example, the BMS used to collect the entire community integration questionnaire, and now we collect only a portion, which is the social integration subscale of that questionnaire. So things like that kind of show you how it is a complicated data set, and it's important to pay attention to the start date and stop date of the data that you're interested in. So this tool is the one that I've mentioned previously on our website under that how researchers can access the database. And Alyssa will talk a little bit more about it in a few minutes. So for the rest of my section of the webinar, I'm going to talk about the data dictionary. A data dictionary is a form of metadata, which is data about data. The term refers to a set of information describing the contents, format, and structure of a database and the relationship between its elements. So when you're trying to understand what's been collected when, or what data the BMS has in the database, the data dictionary is really your best friend. You can see it's an Excel file. It's fairly easy to navigate if you have used Excel at all, but each row, the first row is the title of each of those columns, but each row then is an item in the database. So you'll see, for example, in this row 2, column A, oops, that's the new MSID, which is our participant ID variable. So the data dictionary stores every single question that's ever been collected by the BMS. We do have a status column here. So it shows you whether that data is currently being collected or if it's archived. And then there's more information, a description, the age group it's administered to, the question itself, the coding for the question, and more information. So the types of data, like I already mentioned, some data is collected by self-report and some is collected by medical record review. So you will be able to tell in the data dictionary what's collected in which manner. There are people who have medical record data but not self-report data. So that's one thing to keep in mind when you're looking at the data set and trying to figure out your research questions, because that may reduce sample size. There are also information in the data dictionary about the start date and stop date of variables. Like I mentioned, there have been changes to the database over time. So it's important to pay attention to the dates that the variables were collected. Some items we do have that have been collected since 1994, but others were collected for only a very brief time period and would have a pretty low N if you wanted to analyze the data. So that's another really important point to pay attention to when you're looking at the data dictionary. And another point that's in the data dictionary is discharge and follow-up surveys. So like I've mentioned before, we do have that hospital discharge survey and then the follow-up survey that's collected at 6, 12, 24 months and every 5 years after. So the data dictionary gives you information about what time point each item is administered. For example, I've already mentioned it, but TBSA burn is collected at discharge only. And we also have code books, which Alyssa will cover a little bit more in her section of the webinar, but the code book is a different kind of metadata that shows you the variable names as they're collected in the survey. So it's actually an actual survey that has the variable names added to it so that you can see what it looks like in the survey form itself. And for now, that is it.